kay si Rudita Mayang, ang chairman diri sa ato ang puro. So gipahiabot sa barangay nga anaa kunoy daghan nga first time na mothers diri sa ato ang puro. Og ang barangay opisyales kay nag-suggest nga mag-conduct og lecturing about sa breastfeeding advantages alang sa inyong mga anak nga mga bata pa. So labaw na karon nga nagataas ang cases sa ato ang COVID-19 cases. So mas labing maayo nga maproteksyonan nato ang inyong mga anak. So ana ako'y kauban diri nga nurse na siya ang mag-lecture sa ato ang topic na itapik karon, which is ang breastfeeding advantages. So ana ako'y kanang logbook diri para sa inyong attendance. Ilista ninyo inyong pangalan ug inyong mga perma kay ato aning i-forward sa mga barangay opisyales para makabalo sila kung kinsa ang nag-participate ani na programa. Diri ilista inyong pangalan, ma'am. Diri inyong signature.
Go.
Okay, so good day. Before ta magsugod sa ato ang discussion for today, magpaila-ila sa ko ang kaugalingon. So I am Eliza Alcaide. I am a registered nurse since 2013. So I have spent my entire career working in the maternal newborn nursing area, including the mother-baby postpartum, NICU, antepartum, and labor and delivery. Okay, so I have practiced as an IBCLC since 2017 and have been a maternal newborn nursing certified since 2018. And I have also received a specialized training for prenatal mood and anxiety disorders as well as prenatal bereavement. So who among here has an idea of what is breastfeeding? Okay, so yes, Pam.
So mga gimikanan nga bag-o pang anak nga nagpatutoy sa ilahang mga anak nga mga 1 month, 2 months, or 3 months.
Thank you. That's okay. So according to the presentation, breastfeeding is the act of feeding breast milk to an infant and an infant's consumption of human milk with no supplements of any type. So daghan ta og mga benepisyo sa breastfeeding sa inyuhan ng mga inahan o sa inyuhang mga anak. So breastfeeding has many benefits and advantages, and today that is what I would going to discuss to you all. Okay, so now let us proceed to the advantages of breastfeeding. Okay, so first is the breastfeeding is species specific. So human milk for a human baby is better utilized and easily digested because humans are meant to eat human milk. Okay, so humans are mammals and more specifically Homo sapiens. So as a humans, the perfect food for us as a newborn is a human milk. This is because it is species specific. So additionally, the breast milk is genetically specific for your baby and made specially for your baby with the exact amount of protein, fat, carbohydrates, antioxidants, vitamins, enzymes, and minerals. Okay, so this perfect combination provides your baby everything they need to grow and thrive. So, your breast milk changes as your baby's need change. Okay, so breast milk is always sterile and it's always the right temperature. Okay, so babies who have breastfed have less malnutrition and has a lower infant mortality in breastfeeding. So babies don't need breastfeeding because breast milk is perfect. Okay, so next is breastfeeding contains many antibodies. It can protect the baby from illnesses. So the protection given by the breast milk reduces the risk of illnesses such as viruses, next, bacteria, next, ear infection. Next is urinary tract infection or UTI. Next is common colds. Next is bacterial meningitis. Okay, so next, breastfeeding promotes tranquility and calmness of the baby. So breast milk is better in the stomach due to being a natural food for babies. So babies will be able to digest the milk with ease and reduces the risk of the incidence of diarrhea. Next is vomiting. Next is constipation. And lastly is the gastroesophageal reflux or the GERD. Okay, so next, breastfeeding reduces the risk of dental issues because babies are fed in positions that work different muscles of the mouth and jaw. And because of that, it promotes the proper development of jaw and teeth. So additionally, breastfed babies use less bottles and bottles have been associated with cavities. And then finally, babies have fewer orthodontic issues and speech problems. Okay, so next is breastfeeding reduces the risk of sudden infant death syndrome or the SIDS. So the babies tends to get back to sleep faster due to the oxytocin they receive from the breast milk. It also improves brain maturation, which can cause to higher IQ scores. Okay, so do you have any follow-up questions about the advantages of breastfeeding for the babies?
So, none so far po, ma'am.
Okay, so thank you for answering. So next, let us discuss the advantages for breastfeeding moms. So kung may advantages ang breastfeeding para sa mga bata, naapoy advantages ang breastfeeding para sa inyuhan na mga moms. Okay, so first is the mothers will lose weight after delivery. So breastfeeding burns on average 300 to 500 extra calories per day. Okay, so next, breastfeeding also reduces the risk of having a diseases for the moms. So breastfeeding has health benefits that can help minimize the chance to mothers from having a diseases such as breast and ovarian cancer. Next is heart disease. Next is the arthritis. Next is lupus. Next is the urinary tract infection or the UTI. Next is anemia. Next is osteoporosis. Okay, so that's all for today. The advantages of the breastfeeding for moms and babies. So any follow-up questions? Okay, yes ma'am.
So, how often should I feed my baby?
Okay, so that is a very good question, no? So, you should feed your baby for every 2 to 4 hours, but some babies maybe feed for every hour, and that is called as cluster feeding. Okay, so daghang salamat sa pagpaminaw ug sa makausa, maayong adlaw kanatong tanan. Okay, so daghang salamat sa mga nipartisipar karong adlaw, ilabi na sa mga nagpaluyo ani na programa. Ang atuang barangay opisyales o ang atuang speaker karong adlaw na si Nurse Eliza and also sa atuang dalaygong Diyos.